Hey, how does it go? How does it go on this awesome Thursday? That's right, Transformation Thursday. I'm super excited as always to be here with you all as we get ready to talk about some more life changing and region shifting information here at Northeast Delta Human Services Authority. I am Duran Talley, Public Information Director here at the Northeast Delta Human Services Authority, where our mission is to serve as a catalyst for individuals with mental health, developmental disabilities, and addictive disorders to help realize their full human potential by offering quality, excellent care with greater accessibility. And our vision is to build a unified Northeast Louisiana where individuals are thriving and reaching their full human potential. And we do that using three tenets to guide our actions: greater access to services, excellent customer service, and quality, competent care. It is Thursday, November 21st, and we've had an awesome month of November where we've done the musical with Strauss. We just came off the heels of Red Ribbon Week in October. Just yesterday, we unveiled a harm reduction vending machine at our Monroe Integrated Care Clinic at 4800 South Grand Street. And we also showed off some updates to our Monroe Integrated Care Clinic because we have done some facility upgrades to the rotunda. And so if you've not been there recently, go check it out. We're doing awesome and great things in our clinics in terms of services, but we're also being very strategic and intentional about the aesthetic, about the look, the feel, the sounds, the culture of the space, as well as individuals come in and interact with us. We want them to feel comfortable and we want them to know that it is a safe space. And so all that to say this, now we're getting ready to dive deeper into one of our specialties, one of the things that we don't take for granted and we don't overlook, and that is the work that we do with the Department of Developmental Disabilities. In October, we actually went through several different agencies throughout the region in partnership with our pharmacy, General Pharmacy, to bring COVID-19 vaccinations and flu vaccinations to the vulnerable populations within the developmental disability community. And we rendered more than, I think, 300 or 400 different vaccination shots during that time frame to that population. And we want to continue to reach out. We want to continue to bring awareness and information to the families of Northeast Louisiana, because we all know someone, we may have someone in our household or in our family who have developmental disabilities. And we want you to know that we see you and we're willing to meet you where you are, and that we understand. And so with that being said, we actually have one of our great friends with us today, and colleague, who have just an awesome personality, an awesome spirit, and is very personable and relational. And so, yes, there is a paperwork process that we all dread. But if you have to do paperwork and if you have to go through a process, I guarantee if you go through it with our guest of today, you will enjoy it as you'll enjoy most things that you do, with none other than the one and only Miss Roxanne L. Warren. She is our medical certification supervisor in our Department of Developmental Disabilities. Hey, Miss Roxanne, how you doing?
Hey, Deron, I am doing well. How are you doing on this
Doing
great Thursday?
Yes. It's been an interesting week. We've been working. We've done even a town hall yesterday in Winsboro. So it's been a busy week for the agency, but it's because we're so intentional, Roxanne, to make sure that people know we're available, we're accessible to their needs, and we want to know what do they need, right? And how can we do a better job at bringing them to us? So, Roxanne, before we dive into the formalities, tell us who you are, Roxanne. How long have you been working with this vulnerable population within the DD community?
Well, Deron, I am Roxanne L. Warren, as you said it. I have been working in the DD field actually for about 15 years, and I can really keep up with that year because my youngest son is 15, and I was pregnant with him when I started with this population. I've been with the state for 23 years. And so it's been a great journey to be able to assist and help people and meet a need that is something that they're wanting, something that we can do, and give them just a quality of life that they may otherwise not have.
Wow. Yeah. Wow. 15 years of servicing a community of individuals that are often overlooked and left out, right? Uh,
Yes.
you know, personally for you, how fulfilling is that, right? To know that, hey, there are those that are considered less than, but I've been on the battlefields to show the world that they're just as equal as the rest of us.
It's rewarding to be able to meet a need for someone who otherwise wouldn't have it met, or for someone who's waited
Mm,
for a very long time. Because if you know anything about the history of the waiver, there used to be a 10-year long waiting list in Louisiana,
wow.
in which people had to wait for either someone to die, or if we were able to get additional funding in order to receive another waiver. We're so thankful that we have evolved in the waiver,
Yeah.
and the people of us advocating and stakeholders listening and our legislators listening. And we have gotten rid of what we call a waiting list
Hmm.
for the waiver services. We do have a request, but it's no longer a 10-year waiting list. And we're really trying to evolve as people evolve. The system that tries to assist them
Mm,
needs to evolve along with them. And that's exactly what we're trying to do. And so it's rewarding to be a part of that change, to see that change and see how that change have enriched the lives of the
mm.
people that we serve.
Wow, that's good. As people change, the systems that support them got to change. That's good, Roxanne. We
Correct.
got to quote that and frame it. That's powerful stuff. Let's talk now. You've mentioned it, and this waiver and this long waiting list. But just explain what a developmental disability waiver is for those who don't even know what that is.
And so you have to go back and know that there is a developmental disabilities law.
Mm,
And in order to be able to get a waiver, you have to go through the entry process for developmental disabilities. It is what most people know as the Office for Citizens with Developmental Disabilities. And then we adjourned and got taken in by Northeast Delta. And so now we're still serving that same population. And so in order for someone to get a waiver of sense, they have to go through our entry department at Northeast Delta, and they have to get a statement of approval.
mm,
And in that conversation with the entry staff is asking them, what are you wanting? What are you looking for? What are you in need of? And most
mm,
of them at that point will identify the new opportunities waiver. And they'll identify that specific waiver. It's because it's our largest waiver and it's the first one. And so that's what most people know. What you get in your head, what you've heard of more
mm,
than anything else is what you asking for. And so that in turn starts that process. Before, when you used to do that, you'd go on a waiting list and you'd have to wait.
mm,
Now, once you go through the entry process and you're able to get a statement of approval, then you are assigned for a screening of urgency need, because now the waiver is based on a need. It's based on either an urgent need, an emergency need, a critical need, or no needs at this time. And
wow.
that's what your son is. That is an assessment that will be done. And then based on your response as an individual, a family, a self advocate, based on your response to the questions on that assessment, say where you're going to be as a requester in order to get a waiver.
Mhm,
And so that's basically what it is. But it's a service that
mhm,
you, the individual, has asked for. You have told us what you're in need of. You've told us that you need either in-home services, you're looking for a job, you're looking for more activities in the community, you're looking for something specific. And we're in turn, as a waiver, going to assist you in trying to figure out which waivers. OCDD has 4
mhm,
waivers that best meet your need. So DD waiver is a service. It is
mhm.
a service you request, and just like you request, you can turn it down, but it's a service that you're in need of and that you're looking for, and we're obliged to be able to assist you in obtaining that service.
Wow,
Yeah.
wow. What are some of the biggest challenges, right, that you encounter when you're trying to help under individuals or families uh, understand, I guess, the sun, as you describe it, that screening of urgent need? What are some of the challenges that you all have seen? and how do you
Well,
help them overcome
some of the challenges is knowing that the waiver is forever evolving,
them?
that there's always changes. And what someone else waiver in the policy that was before is changed when now it's you get your waiver because now your need is something now is totally different, that it's evolving. And the waiver is not based on a group, it's based on you. The service that you get is an individual service. What is it that you need? What is it that you're looking for? And can we, based on Medicaid guidelines, because that's one of the big things that we have to make sure everybody understand that these are Medicaid funded
Okay.
waivers. And
Okay.
because they're Medicaid funded waivers, not only do you have OCDD guidelines to meet, but they are set forth by Medicaid. And there's no changing, there's no modifications. And
Mhm.
with that, it changes. And so what somebody else was maybe able to get a year, well, that's no longer available because Medicaid says, no, we're not going to fund that anymore. Or yes, we've added this particular service that wasn't available before, but it's making sure people understand that one, you're choosing these services, and this
Yeah.
is a service, and it is a supplemental service. It is
Mhm.
not necessarily a service that just comes in and say, okay, I got the waiver, I leave. No, it is a supplemental to your natural supports. It's a supplemental to your community support. It's a supplemental service that you're in turn says, I need help. And we're letting you know how we can help you. Yes.
Wow. I love that it's tailored, right? That it's
Mhm,
specific to the needs. Because
mhm.
even if, let's say me and my neighbor, we both have, a family member, the exact same, a child. I have a child with
Yes.
developmental disabilities. They
Yes.
have a child develop. Still, there's different nuances within how I run my household, how I get income, how they get income, how they run. Is it
Exactly.
mom? All those dynamics, right? Even though you're
Yes.
looking at the same condition and situation.
Yes.
Oh, you got two parents, you got three
Yes.
kids. Right? It's still not a one size fits all. It's cookie cut, and I like that.
Correct.
Yeah.
Exactly. And that's one of the things that we always have to say. And that's one of the things that we try to share with them on a continual basis is that mentality of, okay, they got this and they don't have as many this and that. And we're like, okay, what do you need? Tell us how we can help you. And it may look different. There's a policy that says we can do specific things, but how those things apply to you will look different than may how it applies to somebody else. And so trying to make sure that we understand that this is an individual and is for the person with the disability. We're
Mm.
there for the person with the disability. Does the family benefit? Yes. But we're there. That survey is tailored for the person who
Mm.
has the disability, who has the statement of approval. And so that person is the center of how those services will be done. Yeah.
Wow.
Yeah.
No, that's good that you cleared that up because, as parents, as caregivers, right, will how does this benefit me? It ain't about you this time. I'm sorry. Thank you for
Yes.
giving the care that you've given all this time, all these years. However, we're going to help you by doing our part to care as well for
Exactly.
for that one that's in need. Now that's beautiful.
Yes. 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 Yeah. Yeah.
How
Yeah.
do you all stay up to date? Because you mentioned Medicare guidelines, you mentioned OCDD guidelines, and I'm sure the HSA
Mm.
has certain policies and procedures that you want to make sure that you're abiding by. How do you all stay up to
Oh
date
my
with these and even just
God.
best practices within the industry?
It's not easy, but it's doable. And we work as a team. There are 6 med-certs that works the waiver, and it's broken up by caseloads, and we assist the private support coordination agencies. And between the policies and everything now, technology is taking over.
Hmm.
And it is a catalyst for change that we are going through. And so everything is online. So between binders, between emails, between attending multiple Zoom meetings or trainings face to face, but trying to make sure that email is our best friend. It
Hmm.
is our best friend. We go everywhere together. We are hand in hand because when there is a change, we're able to send that out immediately. And normally we have months, sometimes there's weeks. You know about a change that's coming and you've been prepped for the change to when it's going to start, but the start date may be in a week. And so you have to go back and refresh and make sure and go, hey, I know we sent this out a month ago, but look, the date is upon us. It's actually going to be implemented and it's going to start on this day. So starting on this day, don't use that form, use this form. On this day, do this. But email is our best friend, and everything for OCDD, because these are OCDD waivers that Northeast Delta oversees, puts everything online. So we have access to them. The general public has access to them because it's ldh.la.gov. And you can go under Developmental Disabilities, and it'll give you the different services. It gives you for providers, for families, for anything. So we're able to go to their website continuously to see any updates that we may have missed, or if we needed to expound on something more. We always have Medicaid has their policies online. Northeast Delta have their policies online. So that computer and that technology and email is our best friend. And that is usually the best way that we can keep up. And that's why we always ask providers, and we're even asking families, hey, do you have an email address? Because most of us starting now to get smartphones. And so we can get emails and all of these things sent right to our hands. And so with an email, we can shoot something versus having to say, hey, let me put this in the mail to you as a copy. It's going to be 2 to 3 days. Don't let it be a holiday in there. It'll be 4 or 5. So with that, we're able to stay abreast by using email, and the technology with everything being online. It's our best friend.
Wow, beautiful, beautiful. Roxanne, I've enjoyed this conversation with you, and I can go on and on just learning about the Department of Developmental Disabilities at the agency. But real quick, we just want to make sure that we encourage the families to know how to get in touch with you all. You can call to learn more about the waiver process. Remember that Ms. Roxanne shared with us that you have to get a statement of approval first and then come through. If you don't know what that is, or even if you've already gotten it, you can go ahead and give us a call, 318-362-3396. We'll point you in the right direction, and then of course hold your hand throughout the process as well. Ms. Roxanne, anything else you want to share with us?
No, it's been great just having this conversation, and please don't hesitate to give us a call. And this process may not be short, because anytime you need documentation, anytime you're trying to get paperwork, please be patient as we try to get that information in, because we want to make sure that we're able to assist you and meet your need. So if you even think, or you think there's a possibility, please feel free to give us a call at the number he stated, 318-362-3396, and then ask to speak to an entry staff, and they will walk you through, have a conversation. We will love an opportunity to be able to serve you here at Northeast Delta.
Beautiful, beautiful. Well said, Roxanne. Thank you all for tuning in with us on this beautiful Thursday lunch. I hope your lunch has been delicious, and we hope we gave you some food for the soul as well through this Transformation Thursday. Again, give us a call if you need anything, but if not else, follow the Phoenix on social media, Facebook, Twitter, Instagram, LinkedIn, and YouTube at AnyDeltaHSA. And of course, we're available to you on our website, AnyDeltaHSA.org. Until next time, grace and peace to you. Y'all take care.